Assalamualaikum. Today, um, we will discuss about the borderline personality disorder or BPD. So, borderline personality disorder or BPD is a chronic mental health condition marked by intense emotional dysregulation, unstable interpersonal relationship, identity disturbance, and impulsive behaviors. It is associated with a high prevalence of self-injuries, behaviors, and suicidality, and making one of the most challenging disorder to treat. Before that, let me start with a question. Have you ever felt like your emotions were too intense to handle? Maybe during a stressful time in your life. Now, imagine living with that intensity every day. This what people with borderline personality disorder or BPD often experience. So, ayun nga, BPD is a chronic mental health condition where individuals struggle with emotional regulation and they have a unstable relationship, a distorted sense of self, and also they act often impulsively. And sadly, uh, they also link with the high rates of self-injury and suicide, which is yun nga, which is it one of the most serious and challenging disorder to treat. Here is the overview of other treatment approaches. So we have four. The first one is psychodynamic, the third one is pharmacology, and the third one is cognitive behavioral, and the last one is efficacy. So sa psychodynamic is focuses on unconscious conflict in early experiences, lack strong empirical support. And the third one is pharmacology, uses medication to manage symptoms not effective as a standard alone treatment. And the third one is cognitive behavioral, uh, or CBT. So it addresses distorted thinking and limited for emotional and interpersonal issues in BPD. And the last one is efficacy. DBT shows stronger outcomes including reduced suicidality and dropout rates. So, the first one is psychodynamic. Is this look deep at deep seated, which is the unconscious conflicts often from childhood. It is insightful, but lack a strong scientific proof or effectiveness in BPD. And the third one is pharmacology, or simply medication. So this can help reduce symptoms like anxiety or depression, but meds are alone are not enough for treating BPD. And the third one is cognitive behavioral. So this work well for some disorder like anxiety, uh, uh, those who challenging disorder to distorted thoughts, but PPD involves more emotional and relational difficulties. So CBT can fall short, which is that uh, dialectical behavior or DBT has shown that most consistent success reducing self-harm, suicide risk, and dropouts from treatment. We will proceed to the philosophical basis dialectics. So we have two, dialectics as a worldview and the dialectics as a persuasion. So dialectic as a worldview is a reality involves opposing truths that can be integrated and promote flexibility over rigid thinking. And the dialectics as persuasion is the therapist can help or it help clients synthesis opposing perspective to support adaptive behavior change. So sa dialectic as worldview is that uh, these dialectics tell us that life is full of opposing truths, and instead of choosing one side, we can integrate both. The DBT help clients move from rigid thinking like all like all good or all bad toward balance and flexibility. And for the first solution is that the therapy or the therapist can help the client find a middle path, which is instead of swinging between extreme, they learn more adaptive ways to think and behave. So now we will proceed to the biosocial theory. So we have two, emotional dysregulation. So BPD stems from biological vulnerability to intense emotions and difficulties regulating them. And the second one is invalidating environments. Environments that dismiss or punish emotional impressions, reinforcing dysregulation and identity confusion. Which is, here is the biggest question: where does BPD came from? So the biosocial theory says with these two. First, emotional dysregulation. So some people are just biologically more sensitive to emotions, which is they feel things more strongly and take longer to calm down. And the second is uh, they often grow up in invalidating environments, which is these are places where these people say things like you are overreacting or stop being so sensitive. So over time, they teaches this person to distrust their own feelings, creating confusion about identity and behavior of their uh, these two are emotional vulnerability and invalidating surroundings, which is you have the condition that can lead to BPD. And that will be all po. Thank you so much.